So you're trying to make sense of a prostate cancer diagnosis. It can feel like you've been dropped into a new country without a map. A lot of complex terms, a lot of big decisions. Well, in this explainer, we're going to cut right through all that noise. We're diving straight into the official 2025 European Association of Urology guidelines to turn them into a clear, step-by-step journey that you can actually follow. Hearing those words, "you have prostate cancer," is just heavy. And the first question that hits you is almost always, okay, so what happens now? That's why we're here. Think of this as your personal roadmap. We're going to walk through the exact path the experts have laid out, from the very first signs all the way to treatment and life after. So you'll know exactly what's coming and what questions you need to ask. All right, so here's our game plan. We've broken the journey down into 5 key parts. First, we'll talk about risk and how this all gets started. Then we'll look at the actual path to getting a firm diagnosis. After that, we'll get into staging, figuring out the specifics of the cancer. From there, we'll tackle the big one, treatment decisions. And finally, we'll cover what comes next, follow-up, support, and just life. Let's get started.
Okay, let's dive right in at the very beginning. Section 1 is all about risk. Who's most likely to be on this journey, and how does the detection process even kick off?
When it comes to risk, the guidelines are really clear about 3 big, well-established factors. First, and this is no surprise, is just getting older. The risk definitely goes up with age. Second is your ethnic origin. We know, for instance, that men of African descent are at a higher risk. And third is genetics. If prostate cancer runs in your family, that's a major factor to consider. Now here's where things get really interesting. Let's talk about the PSA blood test. The guidelines have made a huge shift. It's no longer presented as just a routine screen for every man. Instead, it's framed as a very personal choice. The key takeaway here is that you absolutely should have a detailed conversation with your doctor about the pros and cons before you decide to get the test. It's all about making an informed decision that's right for you. Okay, so let's say a PSA test or something else raises a potential red flag. What's the process for getting a concrete, definitive answer? Let's walk through the official path to diagnosis. Think of this diagnostic path like a funnel, getting more and more precise at each step. It usually starts with that PSA test. If the level's a bit high, the next step isn't what it used to be. The guidelines now strongly, and I mean strongly, recommend getting a prostate MRI before anything else. And only after that MRI would you move to the final step, the biopsy, which is where they take a tiny tissue sample to get the final confirmation. So why the big deal about doing an MRI first? Honestly, it's a total game changer. The MRI is like getting a high-definition satellite map of the prostate. It helps doctors see exactly where any suspicious spots are. This means if you do need a biopsy, they can target it with pinpoint accuracy. And sometimes the MRI might be so clear that it helps you avoid an unnecessary biopsy altogether. It's a smarter, better approach. And when a biopsy does happen, how it's done really matters. The guidelines make a very strong recommendation for what's called the transperineal approach. That's where they go through the skin of the perineum. Why? It all comes down to one word: safety. This method has a dramatically lower risk of causing a serious infection compared to the older method which went through the rectal wall. It's a huge step forward for patient safety. All right, so a diagnosis has been confirmed. The next step is absolutely critical. It's called staging. This is all about sizing up the cancer, understanding its specific personality, if you will, because that's what's going to guide every single treatment decision from here on out. Before you jump into the numbers and grades, let's talk about this really important concept: clinically significant cancer. What does that even mean? Well, it's a way of saying that not all prostate cancers are the bad guys. A lot of them are incredibly slow growing and might never cause any harm in a man's lifetime. The whole point of modern staging is to figure out which cancers are a genuine threat, so we can avoid overtreating the ones that aren't. Now, you may have heard of something called the Gleason score, which can sound kind of complicated. This table shows how the new guidelines have made it so much easier to understand. They've boiled it down into a simple 1 to 5 scale called the INU subgrade group. All you need to know is that grade group 1 is the least aggressive and grade group 5 is the most aggressive. See? Much more straightforward. And here's where it all comes together. Your doctors take that grade group, they look at your PSA level, and they consider the size of the tumor. They combine all that info to place your cancer into one of 3 main risk groups: low, intermediate, or high. This single category, your risk group, is what really drives the entire conversation about what to do next. So, once your risk group is clear, the conversation pivots to treatment. And this isn't about a doctor just handing down a decision. It's about a collaborative process of matching the absolute right strategy to your specific cancer, your health, and your life goals. First, let's clear up two terms that sound alike but are totally different: active surveillance and watchful waiting. Active surveillance is for men with a longer life expectancy. The goal is to watch the cancer very closely and only step in with treatment if it starts to grow. Watchful waiting, on the other hand, is usually for men who are older or have other major health issues. Here, the goal is to monitor the person and their overall health and only treat symptoms if they pop up. It's a key distinction. So for guys with low-risk disease, the guidelines are incredibly clear. If you've got a life expectancy of more than 10 years, active surveillance is considered the standard of care. Did you catch that? Not surgery, not radiation, but careful, active monitoring. And if the life expectancy is less than 10 years, then watchful waiting is the way to go. Now, when we move into that intermediate risk category, the menu of options gets a bit bigger. For some very specific cases, active surveillance might still be on the table. But this is also where treatments like radical prostatectomy, that's surgery to remove the whole prostate, and various kinds of radiotherapy really come into the picture. For high-risk disease, as you'd probably guess, the approach becomes more intensive. We're often talking about a multi-step plan here. It might be surgery followed by something else, or radiotherapy combined with a long-term hormone therapy, which you'll also hear called ADT. That just works by cutting off the testosterone that fuels the cancer. But even here, for some men, watchful waiting can still be the right choice. But across every single one of these stages and options, the guidelines shout one thing louder than anything else, and it perfectly captures the spirit of modern medicine. The final decision is yours. It is your healthcare team's job to lay out every single option with all the pros and cons so that you can make the choice that feels right for your life. Okay, so a treatment decision has been made, but the journey is far from over. In fact, you could argue the most important part is just beginning. This section is all about managing your health and your quality of life for the long haul. So, what does follow-up look like? Well, it's not random. It's totally personalized to you. It'll usually involve regular check-ins and PSA tests. But one key point in the guidelines is that they're not just going to do scans and imaging for the sake of it. An imaging test is only done if the result could actually change your treatment plan. It's about smart, meaningful monitoring. And I think this part is just fantastic. The guidelines now put a huge focus on quality of life. This isn't just about surviving cancer, it's about thriving. They strongly recommend things like supervised exercise programs, especially for men on hormone therapy, to help with side effects. They're telling you to take an active role in your own health, eat well, stay active, and get screened for other conditions. It's empowering. And that brings us to this really powerful final thought. Taken word for word from the guidelines themselves, prostate cancer care should not be reduced to focusing on the organ in isolation. It's just a profound reminder that this is about treating a whole person, not just a prostate. It's about your health, your happiness, and your entire life. So we'll leave you with this question to carry forward. Now that you have this roadmap, now that you understand the journey a little better, how can you use this knowledge to be the best possible partner with your healthcare team? Because making the right decisions for your unique journey is a team sport, and it all starts with you.